Just got home with your child who has cerebral palsy, feeling overwhelmed by all the care instructions? Don't worry, we've got you covered. In this video, you'll learn exactly what to do at home, how to keep your child safe, and the essential steps to help them thrive. Watch closely. These tips could make all the difference in your child's care and independence. Welcome to our guide on cerebral palsy, or CP. Let's start with the basics. Cerebral palsy is a condition that affects a child's movement, balance, and posture. Essentially, it happens when the areas of the brain that control movement either don't develop properly or are damaged. Most cases of cerebral palsy occur before or during birth, but sometimes it can also happen later due to infections or head injuries. While babies are usually born with cerebral palsy, the signs aren't always obvious right away. They may take up to 3 years to appear. It's important to know that there is no cure for cerebral palsy. It doesn't go away, but the good news is it usually doesn't get worse over time. Cerebral palsy can be mild, affecting just one side of the body, or more severe, impacting both sides. So, how is cerebral palsy managed? Treatment focuses on controlling symptoms and helping your child live as independently as possible. This may include physical therapy to improve movement and strength, medications to manage muscle stiffness or other issues, and support for daily activities like eating, dressing, or learning new skills. Understanding cerebral palsy is the first step to giving your child the best care possible. And in the next sections, we'll show you exactly what you need to know for home care and follow up to keep your child safe and thriving. Now let's talk about home care for children with cerebral palsy. This is one of the most important parts of keeping your child safe and helping them grow. First, always ask your doctor exactly what care your child needs at home. And don't hesitate to ask questions if anything is unclear. The more you understand, the better you can support your child. Many children with cerebral palsy need mobility aids to help them move safely and independently. These may include braces or splints, a walker, or even a wheelchair. These devices are not just tools. They help your child gain confidence and freedom in moving around. For children who have trouble talking, communication aids can make a huge difference. This might include picture cards or even computers and devices that act as a voice, allowing your child to express their needs, thoughts, and feelings. Daily tasks can also be challenging. Some children need special utensils for eating, or other tools recommended by therapists to make simple movements easier. These small changes can dramatically improve independence and confidence in everyday life. Remember, home care is not just about safety. It's about giving your child the skills, independence, and confidence to thrive every single day. Next, let's focus on follow-up care for children with cerebral palsy, an essential part of keeping your child healthy and helping him thrive. First, it's important to monitor your child's condition closely at home. Watch for changes in movement, eating, communication, or any signs of discomfort. If something seems off, don't wait. Reach out to your doctor. Always keep all scheduled doctor visits. These appointments allow the healthcare team to track your child's progress, adjust treatments, and address any concerns early. Sometimes, your doctor may recommend additional tests to ensure your child is developing safely and effectively. Your child may also be referred to specialists for extra support, depending on their needs. This could include neurologists, occupational therapists, or speech therapists. One of the most important parts of follow-up care is physical therapy, or PT. Physical therapy helps your child improve movement, build strength, and develop coordination. But it doesn't stop there. Physical therapy also teaches skills that help your child perform daily activities more independently, from walking and sitting to playing and interacting with others. Remember, follow-up care is not just about appointments. It's about actively supporting your child's growth and independence every day. Now let's talk about medications, an important part of managing cerebral palsy symptoms. While medications don't cure cerebral palsy, they can make a huge difference in your child's comfort, mobility, and daily quality of life. First, your child may be prescribed muscle relaxants. These medications help reduce muscle spasms and stiffness, making it easier for your child to move, stretch, and participate in therapy. For many families, these medicines help their child feel more comfortable and confident during everyday activities. Next, your doctor may recommend anti-seizure medications. Some children with cerebral palsy experience seizures, and these medicines help prevent or control those episodes, keeping your child safer and more stable throughout the day. Finally, your child may need pain relief medications. Children with cerebral palsy can experience pain from tight muscles, joint strain, or difficulty moving. Pain medicines help manage discomfort, allowing your child to rest better, move more freely, and stay engaged in therapy and play. Remember, every child is unique, and your doctor will match medications to your child's specific needs. Always follow the treatment plan. And if you notice any changes, or if something doesn't feel right, contact your child's healthcare team right away. You're not alone in this, and the right care can make a world of difference. Now let's take a look at physical activity and mobility, one of the most important areas of care for children with cerebral palsy. Children with cerebral palsy may naturally have difficulty moving, and this can affect almost every part of daily life. Tasks that seem simple, like walking, sitting, eating, or getting dressed, can take extra time, extra effort, and extra support. For example, your child might struggle with walking steadily, or they may need help using utensils while eating. Even something like putting on clothes or sitting safely in a chair can be challenging. These challenges are completely normal for children with cerebral palsy, and they're not your child's fault. You may also notice sudden, jerky movements. These can happen without warning and may make certain activities feel unpredictable. That's why safety, support, and patience are absolutely key. But here's the good news. The ultimate goal is always to help your child move safely and, as much as possible, perform daily tasks independently. With the right tools, guidance, and practice, children with cerebral palsy can learn new ways to move, adapt, and thrive. Every small step matters, and every bit of progress your child makes, no matter how small, counts as a big win. Next, let's talk about something incredibly important: diet and feeding safety for children with cerebral palsy. Many children with cerebral palsy have trouble chewing or swallowing, and this can make mealtimes challenging and even risky if certain foods aren't managed carefully. Because of this, it's very important to avoid foods that can cause choking. These include foods that are hard, sticky, or difficult to chew. Examples are uncut or large foods, raw vegetables, raisins, cherries, whole grapes, gum, hard candy, marshmallows, and hot dog slices. Foods like nuts, peanut butter, popcorn, and whole beans can also be unsafe because they can easily get stuck in the throat. Even if a food seems small or harmless, it can still pose a danger for a child who has trouble swallowing. That's why one of the most important rules is to always cut food into small, manageable pieces. Smaller bites are easier to chew, easier to swallow, and much safer overall. With the right adjustments, mealtimes can become safer, less stressful, and more enjoyable for both you and your child. And remember, your child's doctor or therapist can always recommend specific foods and strategies to keep eating a positive and safe experience. As you care for a child with cerebral palsy, it's important to be aware of some possible complications that may happen. Knowing what to look for can help you act quickly and keep your child safe. One possible complication is seizures. These may look like sudden jerking movements, staring spells, or moments when your child seems to blank out. Seizures can be brief, but they always deserve medical attention. So if you ever notice anything unusual, reach out to your child's doctor. Another concern is choking. Because many children with cerebral palsy have difficulty swallowing, certain foods may be hard to manage. Choking can happen quickly, which is why safe feeding habits and closely watching your child during meals are so important. Children with cerebral palsy are also more likely to get infections, especially lung infections or urinary tract infections. You might notice fever, coughing, changes in breathing, or pain when urinating. Catching these early can help prevent bigger problems. And finally, bleeding can occur, especially if your child has fragile skin, frequent falls, or medical procedures. Even small injuries may need extra attention to make sure they heal properly. By understanding these potential complications, you'll be better prepared to respond quickly, protect your child, and avoid emergencies. Awareness is one of the most powerful tools you have. Now let's talk about one of the most powerful parts of caring for a child with cerebral palsy: prevention and protection. While cerebral palsy itself can't be cured, there are many steps you can take to reduce complications and keep your child safe every single day. Let's start with what you can do at home. First, make sure to child-proof your home. Simple safety measures, like securing furniture, covering sharp edges, and removing clutter, can prevent serious accidents. Next, ensure your child receives all vaccines on schedule. Vaccines help protect against infections that can be especially dangerous for children with cerebral palsy. And anytime your child is in a vehicle, always use the proper car seat or seat belt to keep them safe. Finally, during bath time, never, ever leave your child alone in water, even for a moment. A few seconds can make a big difference in safety. If you're pregnant or planning to become pregnant, there are important steps you can take as well. Getting regular prenatal care helps detect problems early. Avoiding smoking, alcohol, and drugs reduces the risk of complications for your baby. And remember, never shake a baby. If you ever feel overwhelmed or frustrated, it's okay to pause and seek help. Your baby's safety always comes first. And one more essential step. If your baby ever seems sick, don't hesitate. Take them to the doctor right away. Early treatment can prevent small issues from turning into serious complications. By taking these preventive steps, you're giving your child the strongest, safest start possible. And that makes an incredible difference. As a caregiver, one of the most important things you can learn is exactly when to call the doctor. Acting early can prevent serious problems and keep your child safe. First, look out for signs of infection. These may include a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, chills, a very bad sore throat, ear or sinus pain, or a cough that won't go away. You may also notice changes in your child's sputum, such as thicker mucus or a different color. And if your child has pain while urinating, that may be a sign of a urinary tract infection. Sudden or unusual breathing problems are another red flag. If your child is struggling to breathe, breathing faster than normal, or looking anxious and tired, call your doctor right away. You should also watch for trouble swallowing, which can increase the risk of choking or aspiration. If your child suddenly has difficulty eating or drinks and coughs right after swallowing, get help as soon as possible. Another warning sign is coughing that doesn't stop. Persistent coughing can point to an infection, choking risk, or breathing issues that need medical attention. And remember, if your child's condition is not improving within 2 to 3 days, or if they seem to be getting worse instead of better, trust your instincts and call the doctor. You know your child best, and early action can make all the difference. Staying alert, informed, and responsive is one of the strongest ways you can protect your child's health and well-being. Caring for a child with cerebral palsy isn't just about medical appointments and therapy. It's about creating a supportive, safe, and loving environment at home. These simple but powerful tips can make everyday life easier for both you and your child. First, consider joining a support group. Connecting with other parents who understand your journey can give you emotional support, practical advice, and the reassurance that you're not alone. Support groups can be a lifeline, especially on tough days. Next, keep your home clutter-free. Children with cerebral palsy may struggle with balance or sudden movements, so removing obstacles helps reduce the risk of falls. A clear, open space gives them room to move safely and confidently. Provide a comfortable, supportive chair where your child can sit with good posture. Proper posture makes eating, playing, and communicating easier and reduces discomfort from muscle stiffness. Encouraging communication is also key. Many children with cerebral palsy communicate best through pictures or familiar objects. Let your child point to items to express what they need or want. And remember to repeat and reinforce these actions. This builds stronger communication skills over time and helps your child feel understood. Most importantly, show affection and praise. Celebrate every effort, every small step forward, every new skill, every completed task. Children with cerebral palsy thrive when they feel supported, valued, and loved. Your encouragement is one of the strongest tools you have. With patience, creativity, and consistency, you can help your child grow, learn, and shine in their own unique way. Before you leave the hospital or clinic, one of the most powerful tools you can use is something called the teachback method. This method is simple, but incredibly effective in making sure you fully understand how to care for your child. Here's how it works. After talking with your child's healthcare team, you simply explain in your own words what you were just told. Not memorizing, just explaining. This helps the staff know whether everything was clear, and it gives you a chance to uncover anything you might still be unsure about. Teachback is not a test of you. It's a test of how well we explained the information to you. And if something doesn't make sense, that's okay. The goal is clarity. The more confident you feel before going home, the better you can care for your child. Before you leave, make sure you can confidently say these 3 things. First, I can explain my child's condition. You should understand what cerebral palsy is and how it affects your child. Second, I know how to help my child move, talk, and eat. Whether it's using mobility aids, communication tools, or safe feeding techniques, you should feel ready to support your child's daily needs. And third, I know what to do if my child has trouble breathing, persistent coughing, or difficulty swallowing. These moments can be scary, and knowing how to respond can prevent emergencies and keep your child safe. Teachback is all about confidence, clarity, and empowering you as the caregiver. When you understand the plan, your child benefits in every way. As a parent or caregiver, one of the most powerful things you can do is continue learning. Understanding cerebral palsy doesn't happen in one day. It's a journey. And the more you know, the better equipped you are to support your child's growth, safety, and independence. If you're ready to dive deeper, here are 3 trusted, expert-backed resources you can explore anytime. First, the American Academy of Family Physicians. Their website breaks down cerebral palsy in simple, easy-to-understand language. Perfect for getting clear answers to everyday questions parents often have. Next, Kids Health. This is one of the most family-friendly medical sites out there. It offers videos, animations, and articles designed specifically for parents and kids. It's an excellent place to learn practical tips you can use at home right away. And finally, the National Institute of Neurological Disorders and Stroke, also known as NINDS. This is a powerful source for learning the science behind cerebral palsy, what causes it, how it's diagnosed, and what research is happening to improve future treatments. Each of these resources is credible, reliable, and updated regularly. Think of them as your go-to partners on this journey. Whether you have a new question, need clarification, or are simply curious, they're here to guide you every step of the way. Before we wrap up, let's take a moment to breathe. Because you've just learned some of the most important information every caregiver of a child with cerebral palsy should know. We started by understanding what cerebral palsy is. A condition that affects movement, balance, and posture. We learned it's not your fault, it doesn't get worse over time, and with the right support, your child can continue to grow, explore, and shine. Then we walked through essential home care, from mobility tools like braces, walkers, and wheelchairs, to communication aids that give every child a voice, to simple household adjustments that make daily life safer and easier. We covered the importance of follow-up care, regular doctor visits, physical therapy, and ongoing monitoring, because every small step forward matters. We explored medications that may help control muscle spasms, seizures, and pain, and we talked about mobility challenges, making sure your child learns to move safely and confidently in their own way. You learned how to protect your child during meals with safe diet modifications, and we reviewed possible complications like seizures, infections, choking, and bleeding, so you know exactly what to watch for. We also looked at how to prevent problems, from child-proofing your home to safe car seat use, prenatal care, and never shaking a baby. You now know the warning signs that mean it's time to call the doctor right away. And we ended with helpful tips to build confidence, connection, communication, and independence at home. Plus the teach-back method to make sure everything is fully understood before leaving the hospital. You're not alone, and now, you are more prepared, more empowered, and more capable than ever of giving your child the best possible care. If this video helped you today, even just a little, imagine how many other families out there need this same support. So please, help us reach them. Give this video a like. It tells YouTube this message matters. Share it widely with friends, family, and support groups. You never know who may desperately need this information. Hit the notification bell so you never miss our next patient-friendly guide. Subscribe to join our growing community of informed, empowered caregivers. And comment below. What part of today's guide helped you the most? Your words could help another parent feel seen, supported, and hopeful. Thank you for watching Cerebral Palsy Discharge, Essential Patient Guide. Stay strong, stay informed, and as always, you've got this, and we're right here with you every step of the way. I will see you in the next one.